Welcome to the ThePPod.
Hello everybody and welcome back to the ThePPod, the partnership podcast from the Somerset Safeguarding Children Partnership. It's good to have you back with us, and one of the things we talked about previously is explaining and introducing to you the various aspects of the partnership, remembering that the partnership encompasses all agencies who have a responsibility to safeguarding children. And I'm very pleased today to say that I'm joined in the studio by Dr. Jo Nicholl, who's the designated doctor for safeguarding children for NHS Somerset. Jo, welcome.
Hi, Steve.
Thanks for joining me today. It's really good to have you in here in the studio, and it'll be great to get to know you and get to know your role and how it contributes to the partnership a little bit. So could you just start us just talking to us about what is the role of the designated doctor for safeguarding children? Because it's something I'm sure you're familiar with, but many people will be sitting there scratching their heads thinking, it's a great title. I have no idea what it actually means.
Sure. Yeah, so the designated doctor is a strategic safeguarding role. So I don't do hands-on safeguarding with children, but what I do is help the system to develop policies and procedures to safeguard children more effectively across Somerset. So obviously, I'm a doctor, so I'm doing that specifically with a health focus, but I work together with colleagues in children's social care, the police, education, and across the whole health system to sort of try and coordinate things so that we do things as effectively as possible between our agencies. So, that would be, giving advice on the health impact of perhaps a policy that children's social care was developing, or helping the health system understand a police policy, or, it's sort of backwards and forwards between the agencies. And I'm part of a team at NHS Somerset, and we, between us, all provide support to practitioners who are getting stuck with some of the more tricky safeguarding cases. So we often take calls from GPs or children's social care, sometimes education colleagues. Those would probably be the most common ones, to just say, I'm worried about this child. I'm stuck with this case. I don't know what to do with it. Can you help? So a lot of what we do is between those two roles, really. Sort
of consultation as well as the kind of strategic side of things.
Yeah, absolutely. It's providing advice sort of one level above rather than actually hands-on with the child themselves. Yeah.
But you are still a practicing GP?
I am a practicing GP. I work one day a week in a GP practice in Somerset. And I come obviously from a GP background, which is a somewhat unusual position for the designated doctor. Normally it's a paediatric role. But because I've been doing safeguarding in the for NHS Somerset, was then the CCG for quite some time. And I've always had an interest in safeguarding children and paediatrics through my GP career. And I've done other sort of little jobs, like I was a police surgeon for a while, and I've been a GP educator for quite a while. So all those sort of bits and bobs that I've done over the years kind of have given me the skills that I needed to do this role. So although it's somewhat unusual for a GP to be in the role, I think actually that it does give me perhaps a better overview of the whole system in some ways. But I'm conscious of the fact that I'm not a paediatrician, so I work very closely with our named doctor in the trust, and we kind of buddy up and do a lot of the work together, so we get the strategic and the paediatric focus linked in.
I'm just curious, actually, because we've talked previously in the previous episodes about the change from the safeguarding boards within the local authority to the Safeguarding Children Partnership arrangements that came in from working together. I'm just wondering, have you seen much of an impact in that within your role within health services? Because obviously now there's kind of that equal shared responsibility. How have you sort of seen that change?
Yeah, so I think it's given health a clearer voice at the table, if you like, when making decisions, but also clear responsibilities in our safeguarding. The ICB has strategic safeguarding responsibilities for defined in working together, and one of the other elements of my job, I guess, is to make sure that the ICB are fulfilling their safeguarding responsibilities to the families in Somerset. So, I do give advice to our executive team alongside my colleagues in the safeguarding team, and we also do a lot more assurance work than we used to. We go out and visit practices and our providers who have contracts under the NHS, and to make sure that their safeguarding is effective and appropriate for the whatever service they're providing.
Yeah, it's an interesting. I think quite often people will talk about health. It refers to health within working together, but I think as we've seen in reviews, and as important for everybody to remember, is health is not one single body. It's not one. It's a huge sort of multifaceted beast. And you've mentioned GPs already. You've talked about paediatrics. And I think it's important when we're talking about the partnership, when we're talking about health, is for people to kind of recognise it is multifaceted, and it's important to kind of make sure we're linking in with the right people within that and getting the right voices. Yeah,
it's a complex system. It's taken me a long time to understand how all the bits fit together. And I completely sympathise with someone coming in from the outside thinking, who on earth do I need to actually speak to in this health system? But I mean, really, it's about making sure you're getting the right representative around the table to answer the question that you want to ask.
Yeah.
So, if you've got a child, for example, with complex disabilities, you want a specialist in that area to be advising you on what the impact of that disability might be for that child. If you want somebody who can specialise in telling you about how the whole family work together, then you probably want either the GP or a public health nurse, like the health visitor, who work with families rather than individuals. So, it's important that you just have a little think about what is the question that you're trying to answer and who is the best person to do that. And again, that might be something that someone would come to the ICB team and say, I don't know who to have around the table to answer this question, and we could provide some advice and support with that element as well.
No, thank you. I'm just wondering, in terms of the health system feeding into the partnership arrangements, how do you kind of see health systems best feeding in? And obviously, you're part of a number of the subgroups from the partnership.
Yeah.
So I guess both in terms of your role, sort of feeding into the partnership arrangements, and sort of broadly in terms of health systems feeding in.
So I think it's important that there is a health representative on a lot of the committees and subgroups and things that we run, because we're tripartite. We need to have the three elements of children's social care, police and health represented in the room. And I think from the point of view of strategic safeguarding, the ICB team is well placed to provide that strategic oversight, because we have that broad overview of the whole health system. But we may also need to bring in specific individuals if we need a bit more advice about, for example, how midwifery might be contributing to whatever it is we're discussing. That may be more specialist area.
Thanks, Joe. And just thinking as well, in terms of, obviously, you have very strong links with GPs. Your role isn't just focusing on GPs, but it is broad. But obviously, you've got those close links with GPs. How do you feel, or what do you see in your practice about sort of that best practice, about how they can best support good safeguarding practice in relation to children?
So I think one of the most important elements, and that's been borne out by a number of the serious case reviews and local safeguarding practice reviews that we've done, is to have that professional curiosity, to dig a little bit deeper, ask those questions, be curious about what's going on in people's lives. We're in a very privileged position in primary care that we can be quite nosy and ask, quite sensitive questions very quickly after meeting somebody. So that gives us that opportunity. So it's kind of having your antenna raised for safeguarding risks. And I think the way to get your antenna particularly attuned is to make sure your training is up to date and that you've really got an overview of what's going on in safeguarding, both locally and nationally, what the themes are. I think the other element is to communicate really well. And that's where the GP children's safeguarding meetings can be very useful, because you have the primary care team together talking about some of the families that they're worried about, who seem to be struggling, and thinking, how can we support this family? And are we picking up anything that might make us a bit worried about this family, or that this child's at risk? And just kicking that around as a team and saying, well, I've seen this, I've heard this, gives you a much bigger picture. And then, of course, you may need to bring in other professionals to get that wider picture. You may need to have conversations with children's social care or other health colleagues in the midwifery team, the health visitor team, the paediatric team. So good communication and really putting that jigsaw together so you've got a good overview is critical. And then when you've got a genuine safeguarding concern, it's really about making sure your views are represented in those discussions. So getting GPs to attend strategy meetings is really important. I appreciate it's difficult because they're often very short notice and they're all very busy in primary care, but it's a really critical decision-making meeting for that family. And it's important that the health service is represented, but particularly the GP is represented, because they've often may well have picked up the initial concern or have a wider knowledge around the family, and contributing to things like the Child Protection Conference report. Sadly, the pressure on primary care means that many GPs can't actually get to conferences physically. Yeah. So a good report really needs to represent what they say, and then challenging things with colleagues if you don't feel it's right. If you're still worried about a family or a child, and you don't feel you've had an appropriate response from a colleague, then you need to make your point again and challenge that a little bit.
Absolutely, and that's where we got the Resolving Professional Differences protocol,
absolutely,
isn't it?
Yeah.
And because that's the framework we've all signed up to, and it's so important we get that right, because you see it time and time again, locally and nationally, where there have been disagreements and they haven't been sorted out and they haven't reached a resolution, and then as a consequence of which, sometimes we're, weeks, months, years later, we're then sort of looking at that as a case review, which is a real challenge. It's very difficult, but it's really important, isn't it? I'm just thinking, sort of picking up from what you were saying about child protection conferences and that being very challenging for GPs to physically attend. Have you got any advice either for GPs or for other professionals about how they can link in closer together, understanding that it is challenging for everybody?
So I think there's something about writing reports and communicating with other colleagues in a way that uses a language that we can all understand. So I think when things go wrong, or there are disagreements between professionals, or a message hasn't come across clearly, perhaps in a child protection conference, it's often because the health system are using health speak, the social system are using social work speak, the police are using police speak, and we haven't really understood each other. So I think we need to be good at being clear in our communication and making sure that we've put things in such a way that really a lay person could understand it. But if you take the Child Protection Conference report, for example, a really good Child Protection Conference report from a GP would be give kind of really pull out two elements. One is, what is the impact of the child's health problems on the safeguarding risk?
What does this actually mean?
Yeah. And also, what is the impact of the safeguarding plan that you're proposing on the child's health, or the risks if you don't do anything on the child's health? So you might give an example of, well, if you don't address the fact that this child's being exposed to domestic abuse at home, that's likely to have a long-term impact on their mental well-being, their mental health. But actually, we know that stress in childhood produces really poor outcomes in terms of physical health as well. And actually articulating those points clearly can really help a non-health professional to understand why it's important to be addressing those problems. And, maybe that you want to say, well, your plan's not going to work because actually one of the parents has drug and alcohol use and wouldn't be able to engage with what you're suggesting because they're so caught up dealing with their own difficulties. We need to think family and address that problem first. So it's that two-way focus is, what's the child's health needs, and then what is the impact of the safeguarding problem on their health.
Mm. Are you seeing do you see within your role and with working with GPs and other health practitioners, do you see sort of common themes coming up time and time again? Are you seeing a kind of a rise in any particular themes, for example, or have you seen it fairly consistent over the years?
I mean, we certainly had a spike in domestic abuse, particularly during the COVID lockdown, when, it was a really difficult time for families. They're all jammed in together, not able to go out, under worrying about, COVID, money, jobs, all sorts of things. And no release for the parents in terms of the children not at school for a bit, to give them a bit of a break. And, that was a really stressful time for many families. So I've certainly noticed that domestic abuse has been much more commonly recognised, whether some of it was there and we weren't picking it up before.
Yeah.
So I think that's a definite theme. Sadly, the sort of child exploitation, particularly in terms of county lines and abuse outside the family, is much more prevalent as, the drug culture in the society has become stronger, and that's really challenging thing to manage, because, it's not the parents' fault usually. It's
there's wider influences.
Yeah, it's not that you've got to try and help the parents change the way they're dealing with the child. It's completely out of their control, as that's really tricky. So I think those two particular themes have been perhaps more prominent in the last few years than I remember them being back when I started my career in safeguarding.
I'm just curious, have you seen a rise in mental health needs for children, young people, or for adults, for parents? Because it's, again, you mentioned COVID just now, and that's something that I think was talked a lot about during the COVID period. And I'm just curious whether you have actually seen that in practice or not.
Yeah, very much so, particularly in the adolescent sort of
right
group. There was a massive spike in teenagers requesting support for their mental health, particularly not so much, I think, during the pandemic, but when they all started to go back to school, because they were feeling really isolated. They were worrying about friendship groups, and, they kind of got out of their routine. A lot of them felt safe in their bedroom with a door shut, and then going back out into the wide world. And that's continued to be the case. And we also seeing, some children with really quite complicated, challenging behaviour that's very difficult to manage. So I think that the schools have worked really hard to try and support these children, but there is a need for, I think, some more specialist resources across Somerset for some of these more complicated children.
Thanks, Joe. I'm just wondering as well, quite often we kind of focus on sort of when things haven't worked out well, on sort of poor practice about improving things, which is important. We do, obviously focus on. I'm just wondering, have you got any examples of any kind of particular good practice that you've seen over the years?
Well, generally I've seen some real tenacity amongst colleagues in safeguarding. So be that, paediatricians, GPs, health visitors, midwives, children's social care, police, people really just will not let go of something until they've actually made sure that child's got a better outcome. And I think, I see that quite regularly, people really pushing and pushing, or they keep coming back and asking for support, challenging things. This is still not right, And I think there's a lot of that goes on quietly in the background that we don't perhaps see, in amongst these big cases, because actually they go right rather than go wrong. But I think you do need to be, have that tenacity to safeguard children. You've got to just keep going on and on and on until you get it right. And there are a lot of people out there who are working very hard to do that. So I think generally there's a lot of good work going on.
Yeah. No, brilliant. Thank you, Joe. Just to round off, I think in terms of you and your role and how it's evolved over the years, what advice would you give to anyone who might be early on in their career and interested in becoming a designated doctor for safeguarding children? What sort of advice would you give them?
So I think get stuck into safeguarding at an early stage in your career. And, there are lots of opportunities across the health system to do that. So, you could be asked to sit in, for example, on child protection medicals if you're working in one of the hospital trusts in the paediatric team. You can ask to attend strategy meetings or child protection conferences. GPs can get involved with those as well. There's opportunities to shadow people across the system. I'm going to have some of the community paediatric trainees or junior doctors coming to shadow me at the ICB soon, which I think is a great way of them understanding the strategic safeguarding work that goes on. So I think there's lots of opportunities just to dabble into different bits of safeguarding, ask questions, sit in on things, talk to people about cases, talk to the, come and talk to the ICB, talk to the named doctors in the trust about the sort of cases they're seeing. A lot of the trusts also have peer review meetings where they go through the cases that they've seen for child protection medicals and show the kind of injuries that children sadly have sort of suffered as a result of abuse, but how they unpicked what was abuse and what wasn't, from a medical point of view. So I think just getting involved in all of that stuff, and then hopefully it will lead on to other things if you've got an interest. You've just got to be an enthusiast for safeguarding. I think it's not for everybody, but I think if you can get your teeth into it and just be enthusiastic and tenacious, those are the most important skills that you need to do the job well.
Definitely. It's not easy, but it's good knowing that you do make a difference. That's the main thing, isn't it? Yeah,
it's a very interesting and rewarding job to do. I can completely understand why people raise their eyebrows and think, why on earth would you want to talk all day about children who are being abused? But it's not about that. It's about doing what we can as a system to stop that from happening and protect families and help them thrive and have happy lives. And that feels like a really important thing to do.
Yeah, absolutely. Joe, thank you so much for your time today. I really appreciate you coming in. I really appreciate you talking to me and talking to everybody about your role.
Pleasure.
And about the partnership and how we will link in. And I'm sure I will see you again very shortly in one of the partnership subgroups. So thank you very much for your time.
Thanks,
Take care,
Steve.
and we'll see you again.
Bye-bye.
Bye-bye. As always, if you'd like to find out more on the topics discussed in this podcast, then go to the SSCP website, somersetsafeguardingchildren.org.uk, as well as following the links in the description. All that leaves me to say is thank you again for listening, and we look forward to you joining us here again next time at ThePPod.
Let's work together to help keep children safe.